Hope Clinic has become a picture of God working through His people to provide medical care to the uninsured and needy of our community. It began in very humble circumstances that required setting up in borrowed rooms of the Salvation Army twice a week. First United Methodist Church offered us an unused building that we refurbished with volunteer workers, which opened in January of 2007, becoming the first real home for the clinic. In 2009, to accommodate the rapid growth, an adjoining First Methodist building was transformed into 1,000 feet of more usable space through the toil and sweat of volunteers from 3 different churches. This space has been used to capacity for 7 years. Our thanks to First Methodist for being wonderful real estate partners. What is Hope Clinic? Hope Clinic is a 501c3 charitable medical clinic serving the uninsured of the Garland community. Residents who are covered by Medicare, Medicaid, Parkland Plus are able to receive care elsewhere. The concerted effort of several churches, businesses, and many friends has supported this ministry in various ways, united in providing care to the needy of our community. This clinic serves Garland. It is Garland at its best.
Hope Clinic serves the working poor population of Garland who have no health care coverage and their income is 200% of the federal poverty level. I just did some recent work on a grant proposal and was working with the United States Census Bureau and learned that 46.5% of Garland residents fall within that poverty level. I was just astounded. Also learned that 28% of Garland residents have no health care coverage, so you can see that the need is vast. Our local Parkland Community Clinic has 4,400 people on their new patient wait list and 8,000 people on their follow-up patient wait list. So we really are in the midst of a healthcare crisis. Last year, we had another 7% growth in our patient visit volume. The need for space, the need for more physicians continues. The recent addition of RX Assist Plus, which is a prescription assistance program, has been extremely beneficial to our patient population. Last year, we were able to provide $500,000 worth of free medications to our patients, which certainly helps with their healthcare management. With our growth, we're very excited about the recent gift. We'll be able to double our capacity, and rather than functioning out of 3 buildings, we will now have everything in one.
The enormity of the medically uninsured population has prompted the growth of the clinic. God continues to open doors of opportunity, providing ways that we can better fulfill the mission of the clinic. Doctors have come forward offering care to patients needing specialized care. We now have 12 specialists volunteering at least 1 day per month. A larger clinic space would allow us to see more of the people who must be regularly referred elsewhere at this time.
It has been such an amazing blessing for me to be a part of the Hope Clinic. Since we started here, the opportunities to gather together the physician community and the patients of the city of Garland, along with all the volunteers and the churches, and then to have the opportunity to bring Baylor in as a partner in the Hope Clinic, allowing me to really bring all of my roles together in what is just such an amazing cause on the work that's being done here. At the end of last year, we experienced the loss of a program upon which the clinic was very dependent upon. Project Access was a program through the Dallas County Medical Society that provided many resources, both financially and services to our patients that unfortunately, due to changes in the healthcare funding climate, were no longer available to the clinic. We were very concerned at that time about how we were going to meet the needs of our patients, and we even had some concerns that maybe funding sources from Baylor might not be available. But we're proud to say now that Baylor's committed to continue supporting the clinic in the new facility. We're able to experience growth in ways that we were not even able to imagine at that time. So just another testament that this clinic is really faithfully performing the works that God set before us in this community, and that we're meeting the needs not just of physical health care for these patients, but for spiritual health care for the whole community.
I had been laid off from my job a while back, and I lost my benefits, and I suffer from hypertension, so I needed a place. I needed to find some place that would help me. I came to Hope Clinic, and that's where the miracle happened. They told me they were able to help me, and I found a great doctor, a great staff. They were able to prescribe the necessary medication that I need, and they take care of you. They take care. This is not just a dispensary of medication. This is a full-out clinic. They will treat you, diagnose you, spiritually help you. It's a bridge between till I can get a better job. This is the only hope I have. And so it's really, truly a hope clinic.
To me, it's very exciting to be able to use my medical knowledge and skill to benefit a group of people that typically have struggled to get access to quality primary medical care. It could truly be said that our uninsured patient population is the most medically needy, but often they've had to rely on sporadic care, lack of continuity of care for their chronic medical conditions, and overuse of emergency medical services. But even more so, Hope Clinic offers me an opportunity to openly and actively combine my Christian faith with my medical practice. But the greatest gift, though, is knowing that by keeping the Christ at the center of all that we do, that we're impacting our patients' eternity.
3 years ago, I was laid off and my insurance went out the window. My husband is a chronic diabetic and he has had 2 amputee surgeries. Hope Clinic has tremendously helped us. We didn't have anywhere to go. The staff here is great. So we believe in God, and we couldn't be this far without God and Hope Clinic.
As a spiritual care counselor, I think I and our team that works here have the best job, the most fun job here at Hope Clinic. We have the privilege and the joy of sharing Jesus Christ with our patients on a daily basis. In this room right here, a 4x6 room, we've had the joy of sharing and leading more than 1,000 people to Christ. But that's not all that has happened in this room. We've had the privilege to pray with our patients, share their problems with us, and we get to encourage them, give them some direction, and help them in that way.
I've been here currently about 3 years. I work for Brahms, and they do not provide health insurance for me, so this clinic has been a blessing to me. They help me with all the medication I need. They've also helped me spiritually. They have prayer in the mornings before they start their sessions. I am grateful for the Hope Clinic of Garland and the Friendship House in Garland and for what God has provided me.
Well, this is a joyful story that continues to unfold of what God can do when churches, organizations, and ministries work together to advance God's kingdom. We can do so much more together. Temple Baptist Church, with Pastor Martin Spell and his wife Barbara, who have ministered in that congregation for over 45 years, with a love for people, a heart for God's work. So in January of this year, I attended a business meeting of Temple Baptist Church in which they voted unanimously to deed the property to Dallas Baptist Association to realize a vision of a thriving congregation in their facilities to reach their community, which had changed dramatically in these 45 years. So it was a vision of a Hispanic congregation with a bilingual ministry and also providing adequate space for a wonderful ministry called Hope Clinic. The Temple Baptist Church has taken good care of their buildings through the years, but buildings built in the 1950s and 1960s would need a major investment to update and bring them to code to maximize their use for God's kingdom. So we prayed and began to look for a partner to help realize that vision. We talked to several churches, and God clearly led us to Lake Point Church and Pastor Steve Stroop. And they have followed through with that. And so in March of this year, we deeded the property to Lake Point Church to realize this vision.
The people of Lake Point consider it a high privilege to be able to be in partnership with Hope Clinic and redeeming a part of God's kingdom resources. Because of the generosity of the Temple Baptist Church, we now have a resource that we can share with Hope Clinic to provide necessary medical needs in the community where it's located, and at the same time plant a church in that building that will be ministering to the very people who will be coming to Hope Clinic. I think it's great synergy, and I really think it's something that God has put together in His sovereign will.
Because of the combined efforts of many and through the marvelous generosity of Lake Point Church, we are now anticipating the opening of a remodeled 4,000 plus square foot portion of their new building. Hope Clinic will be responsible for transforming one wing into a medical facility. Services added have always been dependent upon space and of funding for sustainability. The partnership with Baylor, which began in 2009, has been seminal to the clinic's growth into a provider of quality health care. Baylor continues to offer abundant resources that, combined with the care Hope Clinic provides to the indigent population, serve as a catalyst to help meet the needs of our community. We salute Baylor, a wonderful friend to us and Garland. We ask you, the community at large, to pray for this ministry. We are your hands and feet. Thank you to all who have supported us. We ask you to continue to partner with us in this effort to serve in the name of Jesus Christ.
I worked for 4 different companies and never had insurance. You know, if I was hurt, I was just hurt. You know, I never went to the doctor because I know it was too expensive and I didn't have the money. I didn't have Medicaid or something to pay for it, so I never went.
I don't want them to have to struggle and not be aware of resources in the community and that there is hope out there and life can be easier.
Thank you for my first time here. Very, very happy.